And
Cool.
we live. Okay, we are live. This is my first of many live videos. It looks like I'm here with Dave McNaughton of, is it DMC Health now? You've got a new
Yeah,
business
that's the
name.
one.
Okay, now you are on. Um, so Dave McNaughton, you PhD candidate, highly educated and experienced chiropractor. Now just opened his practice in Chatswood. Tell me, introduce yourself. You're on now.
I'm on now. Good
Yeah.
stuff. Hi, I'm David. I'm a chiropractor in Chatswood here. I've got my clinic, DMC Health and Wellness, and I'm also a PhD candidate at Macquarie University in psychology. So I look at how thoughts and feelings influence symptoms and how that relates into clinical practice.
Awesome. And Dave's worked on my shoulder, a couple of different injuries I've been harboring, and he's just recently opened. So it's a perfect time to open a business. We were just discussing that.
It's great. It's great. Somewhat comical in the grand scheme of things, but you look back on this, and I had patients that opened up businesses in the GFC, and they're still around. So we'll get through it.
Yeah, absolutely. Chiropractor. I wanted to talk to a couple of different people. Definitely someone who is an expert in the musculoskeletal system and actually like behaviors and habits. So you kind of tick two of those boxes. I guess the people that are what's happening with people now are that they've gone from being highly active, people who are taking care of their bodies, exercising rigorously daily, to, I hate to say it, but completely sedentary and inactive. Talk me through your thoughts of like what's going on with their bodies and things like that, both general health and in the musculoskeletal system.
Definitely. Well, I can talk to this quite well because I could probably put myself in that category. To be fair. So I went from training almost every day, every second day, and it was part of my routine and part of my just what I did type thing. Got me through the week to the beginning of March, which was good, and then all this stuff kind of blew up about 2-3 weeks ago, and all of a sudden I can't go to gym, and I'm having to go outside and do all this other stuff. And so, from personal experience, this is quite real. Firstly, I think a lot of the gyms are doing a good response to it all and just trying to get content available and easily available for people. But I think a lot of people are going to have to take a bit more of an active step to becoming or maintaining their activity level to start with. So I think that just starts. And that will take some time. It's been a big shift for a lot of people quite quickly. So don't get too hard on yourself with this kind of stuff. I think you're allowed to give yourself a week or two of just reset, take it all in, kind of get a plan of attack together, figure out what you want to do, and start from there. So, from personal experience with all this sort of stuff, everyone's gone from a nice routine. Sometimes the gyms are quite a social area for them as well, to all that shutting down quite quickly. So I think get a plan of attack together. So that's the first step with it all. I've definitely noticed in me all my aches and pains start to come back a little bit because I'm not exercising. And this is we always knew this would happen. It's just happening on a bigger scale because with everyone. So when you don't move, you notice that these things become more apparent. The things will get tighter, things will get stiffer, pain will become more common, essentially. Exercise is really, really important to stave off that kind of stuff. So, yeah, it's a tough one for everyone at the moment, but I think, we'll be able to adapt through it. And as I said, the first part is just take a step back and reset and then get a plan together and what that actually looks like.
Yeah. So I see a lot of people. My clients are taking photos of their their spaces and their activities they're doing, and they're taking photos of what are those big bloody big things you sit on with the little balls in them. So what's that called? Those big cushion things that you sit on, and they've got the little balls, the little foam balls.
Oh, like the rollers and stuff like that.
No. You relax on them. They're for hippies. Hippies use them instead of chairs. Anyway, so people are just their routines have changed, and the way they're sitting, their postural, possibly their home environment hasn't been designed as optimally, because they didn't prioritize their their home work environment. People tell me, I've got a standing desk at work, I've got this, that, and the other, I've got all these routines to keep my body in good check, but they probably have neglected their home office. What things could they be doing at home, or changes they could make to their home environment to keep off their, they've got now starting to get like sore middle backs, sore lower backs, and those types of things?
Great question. Also, from personal experience, I've also gone through this the last 2 weeks. I
should show you mine. I should show you my setup. It's awful.
It's just wild, essentially. So the exact same thing. A lot of people are going through this phase now where they're shifting to homework or off-home working environments, was, as you said, not necessarily set up for that kind of stuff. There's been a big push in work environments to make them more ergonomical, and especially over the last couple of years with standing desks, and it's become just a normal thing in the office, essentially. And there's been a big push because businesses have found you increase your work productivity when people are more comfortable, essentially. And now we're being forced into situations where, me personally, I didn't have a desk set up at the new office just because it was new, and now I'm kind of forced into it a bit and hurting the back on the couch when the couch was really not designed for me to be working there for 3-4 hours at a time. So, this sort of stuff is really coming back to getting that plan together and just set up a good office space, essentially, at home. What that actually looks like is, it's exactly that picture that you have in your head of what an ideal posture looks like when you sit. So you want things at eye level. You want the chair to be comfy and have a good support there, so you're not leaning forward through it all. I tend to like cushions as well, just to support it at a chair even more, usually because they're not great office chairs, so a lot of people pulling, dining room table chairs or stuff like that out. So just make sure you've got good support. The main thing is the eye level with the computer, and if you can set up your monitors better, that makes a big difference, and you'll notice you can go for longer. The big thing that I say, and I continue to say to all my patients with stuff like this, is even though you're at work or if you're at home, you still need to move. So the general rule of thumb with this sort of stuff is no one position is good for a long time. Even if it's the most ideal position, you might be able to go a bit longer, but the idea is you need to move still. So every 45 minutes to an hour, stand up, get a drink of water, stretch out or something, and that needs to become your regular habit. It was your regular habit at work because you had a standing desk and you were able to do it. You could stand up when you wanted to stand up, and you could sit down when you want to sit down, and it's about that varying posture, that varying movement. No one position is going to be helpful, especially if you've got pre-existing back pain or other issues. If you're in that one position, the body will stiffen up, and you'll start to notice these aches and pains a little bit more. You won't notice it the first day, it'll be the third day, and it'll be the third week, and then things will kind of fall apart a couple of weeks in. So your body will adapt to a certain point until it can't. There's capacity with this kind of stuff. So setting up from the beginning will help you a bit of longevity and all that, but the trick with it all is to move, essentially. Take breaks, regular breaks, get up, move around, and then get back into it.
Good one. And is there any type of specific stretches or anything that you can recommend, or stuff like that, or any resources you can recommend?
The internet's full of this at the moment. You could find simple stretches and stuff like that. The main thing is, one, stand up. If you've been sitting down, stand up. And then from there, I kind of just like the old goalposts, just squeezing your shoulder blade back, maintaining that, and then just reaching up to the top. So essentially all we're doing there is we're just reversing that forward posture. And we're just getting all those muscles which are being turned off in that position, and we're just turning them back on. So when you sit down, all of a sudden your shoulders will be much more active through there. Goalposts, reach up. You're doing that a couple of times. There's other ones, Ruger as well, where you can just have your arms out and deep breath in. And as you breathe out, you externally rotate your shoulders or your arms. And that does the same thing. You're just opening things up. So there's some two very, very simple stretches. You can find a whole bunch of stuff on the internet as well. If you wanted to go even further, your foam roller through the middle of your back, if you wanted a bit more time on it, if you've been sitting down for a while. The idea is over time, if you've been sitting, you're going to be going this way. So just do anything that opens you back up. That's the kind of trick with these stretches and exercises.
That's good. There's some really good tips there for you. There's the other thing that we discussed previously, and you might have something to say about this, is you were talking about, I think you had an interest in habits and behaviors and helping people build new routines. And again, it's that time where people have their routines and lifestyles will be shifted on their heads, and they've got to build new routines as quickly as possible so that they can keep the ball rolling, either keep active or keep their stretches going. Do you have any tips? About habits?
Everything's going to be thrown in the deep end with this. Your kind of normal routine is kind of somewhat out the window, and there's going to be a bit of, allow yourself to have a bit of flexibility towards this kind of stuff. I think maintaining as much as you can previously, before all this sort of stuff, is really important. So if there was a day that you normally go get your shopping, still do that on that day. If there was a time where you normally would go see your friends or talk to your friends, you can still do that. Just call them up or, FaceTime, group FaceTime. So maintaining that habit that you already had in place will make the kind of shift a lot easier. Exercise is a big one. Having some form of outlet it's just going to help with your mental health. I exercise for my mental health more than my physical health. So finding a form of exercise that helps you the best with that. So, and that really comes down to what environment you have or what you have available. If you did weights at a gym and you don't have weights at home, it's going to be hard for you to do weights. So, finding something that, and there's plenty of things online in terms of online classes for yoga or Pilates or, heaps of people putting out just body weight exercises or something like that. So trying to fill that gap that's already there with something that's accessible is really important. So I think there's a bit of a shift from trying to make new habits to just replacing old habits, if that makes sense. You really don't need to. Everything was there in the beginning if you were active and all that kind of stuff. It's just maintaining that and just tweaking it, I think. Finding what's available and what you have access to, and then moving on from there. And still, as I said, contact with your friends and keep social. If there's days where you went to the shops or you did other stuff, try and maintain that as well. That's really important. Just because you're somewhat isolated doesn't mean you're neglected. There's a lot of things you should be doing. If that makes sense.
Yeah, absolutely. I was at Virgin Active for a while. I had a gym membership, and I kind of knew it would close, but I didn't really. I didn't think it was. I didn't process that it was going to happen and what would happen if that was the case. It took me days to think, hang on a sec, this has made things incredibly difficult for me. I have literally no backup plan, and I was a little bit complacent myself, actually, to be honest, because I'm like, oh well, I'm a trainer. I have a mind full of exercises I can do, but yeah, definitely a bit of complacency came into place, and then I'm down at the beach now, so I was like, oh, I can go run and swim, and then the beach is now closed, and I actually went to Palm Beach on Saturday, and there were police patrolling the beach and the park next to the beach, telling people to move on. That's when I thought, hey, they're taking this pretty seriously.
Yeah. Yes.
So yeah, I think definitely putting together a plan, as you said, that is sustainable and not kind of idealistic is a pretty good idea.
Definitely. And in for the long haul, like potentially this is going to be the next, we'll say 6 months.
Yeah.
So, that's a lot of exercise, and there's lots of things you can do at home and making it appropriate for what you have, and then slowly build from there. If you want to get more stuff, and it's hard to get gym equipment at the moment, but slowly build it and see what you can get.
Yeah. So, what are you using at the moment? Did you hire some stuff from CrossFit Chats, or did you?
I had, luckily, whilst it was good to open the clinic 2 weeks before all this stuff happened, I had a bit of rehab equipment available that I actually got before, which
right.
So the clinic stuff every now and there. But I'm actually enjoying the old guys at CrossFit Chats did a pretty good job getting some just body weight workouts. And on Saturday, I just went to the park and did a 45-minute body weight workout, and it was great. It was very different to what I'm used to. So it was actually quite nice. So took the dog, and it was good.
Yeah. So, oh, the pup! You got your pup. That's
yeah,
right, cutie. So, and do you have any comment on the cardiovascular system? Obviously, we've talked about the musculoskeletal system. Cardiovascular systems as the other thing to consider as well. Do you have any comment on?
Yeah, it's just maintaining that level of fitness. So this is going to be a time, everyone's activity level is going to be reduced somewhat. There's not going to be as much demands. That's okay in the short term type thing, to go through little phases like this, and you can kind of look at it as a little holiday for a little bit. But definitely, exercise is one of those things which is so many benefits, including musculoskeletal, cardiovascular. So we're improving our CO2 volume. So it's really you just got to do something to maintain that. It's the same thing with a muscle. You use it or you lose it. It's the same thing with your blood oxygenation kind of ability, essentially. So either use it or you lose it. So it's going to be really hard when you go back, or you can be doing things now. If, stationary bike, rowers, you can still go for a run or a walk or stuff like that. That's fine. But it's just just maintaining that level is important.
Yeah.
So.
Oh, it's good. So tell people where you're located. You told me, gave me an idea. Where are you practicing out of right now?
Right now I'm doing pretty much urgent and acute cases, essentially. I've kind of backed off clinic quite a bit, just because it's quite hard for me to do appropriate social distancing in the clinic. So I'm in Chatswood, the corner of Penshurst Street and Victoria Avenue, essentially. So nice, beautiful space. You got to get over here, and you actually got to see it. So
I've got to get over there soon as well. I said I would, and then all this happened.
Yeah.
So I'll be booking an appointment as soon as we can, as soon as the time is right. So yeah, just leave a comment with your address and all that at the bottom. So if anyone, when this all blows over, needs to see you for their back and whatever else, I can attest that you're pretty damn good at what you do. You'll help people achieve their pain relief goals. So
throughout all of it, I'm still doing some jumping on the telehealth appointments. So if anyone needs anything, and I wouldn't recommend, if there's issues, just kind of putting up with it for too long. So some advice and some reassurances can be quite timely with this kind of stuff to kind of get you through it all. So all that stuff's still available. And the final thing is I'm doing a pain webinar on exactly that kind of stuff in a week or two, and I'll post some of the information for that as well. So that's free for the community.
Oh yeah, cool. Yeah, you mentioned that at the start. Yeah, post that. Post a link to that, and I'll log in too and have a look at it. That'd be good. Awesome, mate. Lovely to chat to you. We'll do it again. You're always a good guest, easy to talk to, so makes it easy for me. So thanks, mate. I'll be signing off. I'll be hanging up now and signing off the podcast, the Facebook Live. Cheers, mate. Take care.
See ya.
See you, mate. Good stuff, mate. I think that's done, yeah.